Okay. And welcome to the webinar. I'm Dr. Bill Shaw from the Great Plains Laboratory, and I'll be talking about the question, is a ceasefire needed in the war against cholesterol? Cholesterol-lowering drugs are some of the biggest money-making drugs in history, and unfortunately, the amount of money associated with the drug sometimes is associated with excessive exuberance about the benefits, to the point where some physicians may even be recommending trying to get the cholesterol to completely disappear. So tonight I'm going to be talking about the benefits of cholesterol and how cholesterol is an essential nutrient that's especially important in the developing brain and in maintaining a healthy brain. So one of the very interesting book I came across was one by Dr. Dwayne Graveline, who is a former astronaut as well as a physician with a master's in public health, and he's now written several books about the side effects that are associated with the statin drugs, and the statin drugs being used to reduce cholesterol. And I think it's really about five books that he now has out on the benefits of cholesterol and the toxic effects of the common statin drugs. So one of the most compelling stories that Dr. Graveline talks about is that he was in the Air Force, and in the Air Force, because he was in the astronaut program and so forth, he periodically had to have physicals that included laboratory tests. So Dr. Graveline did the test, and they told him he had an elevated cholesterol. Now, when people talk about cholesterol or elevated cholesterol, they're talking about the total cholesterol, which includes the three types of cholesterol. There is LDL cholesterol, HDL cholesterol, and VLDL cholesterol. So when people talk about cholesterol, they're talking about all of these. So his value was elevated, not a tremendous amount, but they said you need to take this common statin drug, which lowers cholesterol, and I'll be talking in a short while how the statin drugs work. And after he had taken it for a while, he had gone out and walking in the woods, and when he came back to his house, he didn't recognize it. And then he noticed there was a woman there, and he started looking in the window because the house really didn't look like anything he remembered. And then his wife came to the door and offered him milk and cookies, and he didn't know it was his wife, so he thought the strange woman was trying to seduce him with milk and cookies. But somehow he came into the house, and she got him in the car to see the neurologist, and it was suggested maybe it's not such a good idea to be taking this drug. And he stopped, and within a short period of time, all his memory returned. However, this didn't sit well with the medical team in the flight training, and so when he had his next cholesterol, they say, "Well, your cholesterol is still high. We need to lower this." He says, "No, I don't want to do this. I had some really bad side effects and altered memory, and so I don't want to mess with that stuff anymore." but they said, oh, no, you're mistaken. That couldn't be. That was just a coincidence. Unfortunately, it wasn't. He started taking the Lipitor again, and this time, only within hours after taking it, the memory was gone. And this time, the episode, the extent of the memory loss went much deeper, and he couldn't remember anything that happened after high school. He couldn't remember that he had gone to college, that he had a wife, that he had gone to medical school, that he was a resident, an astronaut. All of those things were gone. The last thing he could remember was his high school prom. Anything after that was completely lost. So Dr. Graveline, as a result of this, started a web group and started investigating if this happened to other people. He started writing a column and had a listserv, and very soon he was flooded with people who had similar loss of memory as a result of taking the statin drugs. So he was absolutely deluged. He had an airline pilot who wrote in anonymously to say he had completely lost his memory in the middle of the night in the middle of the Atlantic Ocean as the pilot of a large passenger plane. So that was a very scary thing, and these things are very common. There was the CEO of a large company who started taking statin drugs, and he, in essence, was ousted because the memory loss was so severe from taking the statin drugs. And this type of relationship between cholesterol, low cholesterol, and poor memory function has now been documented in a large number of different studies. So this is one from geriatric psychiatry and neurology a few years ago. They looked at 3 groups of people: elderly people with dementia, other people with depression, and normal controls. And they did these standardized tests that assess the person's mental state and that are commonly used for Alzheimer's disease and also depression. And what they found is those individuals who had either dementia or depression had much lower amounts of plasma total cholesterol and also lower HDL cholesterol than normal people. So both total cholesterol and HDL cholesterol were very low with people who were depressed or had cognitive impairment. And this has now been replicated in a wide range of studies, some of which are on the Great Plains website. If you go there and go to the end of the website, there's a long list of references that you can check out. Another study, this one in the Journal of Neurology and Neurosurgery and Psychiatry. They looked at healthy middle-aged women, and look right down here to the bottom. Higher serum concentrations of LDL cholesterol and relatively recent increases in total cholesterol and LDL cholesterol are associated with better memory. Now remember, the LDL cholesterol is frequently referred to as bad cholesterol, but this article is indicating just the opposite, that people who had high values of so-called bad cholesterol had higher memory. So the terms good and bad may depend on which side of the pharmaceutical divide that you're on. If you're a pharmaceutical salesman, of course you want to call the LDL the bad cholesterol, when in fact it's now been proven that LDL cholesterol is extremely important in transporting needed cholesterol into the brain, and also that it enhances the immune system. So both increased LDL cholesterol, bad cholesterol, and increased total cholesterol associated with much better memory in middle-aged women. Another one, this was in the Framingham study, which was a very large study of people who were being evaluated for the relationship for cholesterol and heart disease. So it was found that those who had the lowest cholesterol, and in this study, the lowest cholesterol was about the group that was around 200, which a lot of people think that is that you should have give statin drugs till everybody is lower than this, but they found that people who, in this study, the 200 was the lowest. Most of the people had much higher values, 260, 280. They found the people who had the lowest cholesterol had the worst performance on cognitive tests of word similarities, word fluency, attention, and concentration. All of these abilities were best in people who had the higher cholesterol, the cholesterol values that people that drug salesmen are saying you need to reduce these kind of values. And it was found that those people who had the very lowest scores, in other words, the poorest memory, the poorest cognitive abilities, were those who had a cholesterol less than 180 milligrams per deciliter, which is the target that a lot of physicians use as targets for where you want to have the cholesterol lowered to. And in fact, this is showing just the opposite, that your mind and your cognitive abilities diminish, and that if you go below 180, they're really severely affected negatively. Another study, and the topic changes a little bit. What I'm talking about in this slide is aneuploidy. What aneuploidy means is that the number of chromosomes that are in the cell. So humans have 23 pairs of chromosomes, which means a total of 46 chromosomes in normal cells. However, when cells divide, they sometimes make mistakes, so the person may have 45 chromosomes or 47 chromosomes. So these are cell divisions that are taking place after we're conceived, during fetal development, or during childhood, adult, or even old age, that some cells continue to divide, and as they divide, they make mistakes. So very interestingly, they found that two diseases, one is a neurologic and immunologic disease with a very long name of ataxia telangiectasia, and the other one is in Alzheimer's. And what they did is they looked at brain samples, presumably at autopsy, of people who had died of these diseases, and they found that those individuals who had this severe neurologic disease with ataxia, meaning very poor balance, imbalance all the time, that they had a very high percent of abnormal aneuploid cells, the cells that don't have the right number of chromosomes. Remember, 46 is the right number. Either too much or too little both cause problems. And for example, people who have cancer commonly have these abnormal number of chromosomes in their cancer cells. So what they found is that in people with Alzheimer's disease, the percentage of total aneuploid cells wasn't that different, but when they looked at one specific chromosome called chromosome 21, the same one that's abnormal in Down syndrome, that individuals with Alzheimer's disease had 10 times the amount of of abnormal chromosome-specific abnormalities compared to individuals with normal. So those with Alzheimer's had 6 to 15% of their brain cells had abnormal amount of chromosomes compared to only 0.8 to 1.8. So roughly 10 times as many abnormal cells, and indicating that this abnormal cell division is a common hallmark of severe neurologic, neurodegenerative diseases. So why could this be? So Experimental Cell Research, Volume 300, the authors studied the process of cell division, and what they found is that if the individual was starved of cholesterol, it was much more likely that abnormal cells would be formed, and if they supplement with cholesterol, it completely stopped these adverse effects, indicating that the abnormal cell formation is one of the things that is associated with cholesterol deficiency. By the way, these abnormal multinucleated cells, where the cells may have 10 or 20 or 30 nuclei in one cell, are also a characteristic of HIV or AIDS infection, and it's found those individuals who have the most severe form of AIDS also have the lowest values of cholesterol. Now I want to turn to how the statin drugs work and how they affect the cholesterol pathway. So this is a very important pathway. This is the biochemical procedure by which the body forms cholesterol, and this goes through virtually all the higher all the mammals and reptiles and so forth. Use basically the same biochemical pathway. You start with simple molecules like acetyl-CoA, and they become progressively larger until you produce a relatively large cholesterol molecule at the end. So cholesterol metabolism is extremely complicated. So I'm giving, this looks complicated, this pathway here, but the true pathway is much more complicated. It's estimated there are at least 200 different biochemical factors that alter the cholesterol pathway. So it's an extremely complicated one, and this is just the rough outline of one of the most well-known cholesterol synthesis pathways. So your body takes acetyl-CoA, and this is an important aspect, which is these raw molecules to make cholesterol can come from sugar or carbohydrates, they can come from fat, and they can come from protein. So virtually any food can raise a person's cholesterol, and there's a tremendous number of things that regulate this. One of the first enzymes in the cholesterol pathway is called HMG-CoA reductase, and this is the enzyme that is inhibited by all the statin drugs. For those of you who like the natural therapies, you may remember there's like a red rice extract that is supposedly natural, but I just want to warn you that even though it's natural, the red rice cholesterol treatment also alters the same enzyme. So even though you have this natural agent for regulating cholesterol, there's no benefit over that other than the fact that perhaps it might be cheaper than the statin drugs, but it does exactly the same thing, which is inhibit the HMG-CoA reductase. So if the statin is present, this first step in cholesterol synthesis is inhibited. The important thing to know, though, is that in addition to inhibiting the production of cholesterol, there are many other products that come from the same pathway, such as isopentenyl pyrophosphate, which modifies a transfer RNA that prevents the genetic code from being misread. There are geranyl pyrophosphate, which alters the abilities of different proteins to perform their function. There are products that produce heme A, an important protein in the mitochondria that's involved in producing energy, a supplement, a biochemical cofactor called dolitol, and coenzyme Q10 are all produced in this pathway. So when the statin drugs are used, all of these intermediate compounds may also be affected. In addition, this pathway also produces a cholesterol-like molecule that forms vitamin D. And then, of course, the last step in the procedure is cholesterol itself, which is used for many different biochemical functions. It's been found that in individuals who use drugs like statins that inhibit this first step in cholesterol synthesis called HMG-CoA reductase, that there is a significant decline in coenzyme Q10. So it's very important for anyone using statin drugs to supplement with coenzyme Q10. And there have been tremendous number of side effects associated with this, in addition to things like memory loss and fatigue, that there's also more severe damage. One of the most common side effects of the statin drugs is called rhabdomyolysis, which is the breaking down of muscle tissue. So the muscles just disintegrate. The disintegrated muscle tissue then gets in the bloodstream, clogs the kidney, and can cause kidney failure. And if you look on the internet, there's a wide number of these different law firms that are just specializing in individuals who have had severe side effects from the statin drugs. A colleague of mine in Texas, who's a general practitioner, says 50% of the patients in his office are there due to the side effects of statin drugs. He said virtually all of them have low cholesterol, they're extremely fatigued, and they're almost always depressed. And so the success of the statin drugs financially is counterbalanced by the tremendous number of people who suffer as a result of the excessive use of these in individuals who may not even require them. Another substance I mentioned, the heme A, the formation of this substance is inhibited by the statin drugs, so that the energy production in the mitochondria does not function right. And of course, that can be the reason that many of the people taking these drugs have extreme chronic fatigue. Now I want to turn to the subject of autism. So I'm going to start with discussing a genetic disease in which most of the individuals have autism, and then I'm going to switch to individuals who have typical or regular autism, in that they don't have any known genetic cause of their autism. But starting with this disease called SLOS, you can see something about how cholesterol is an essential element for the brain function and all of neurologic functioning. So first of all, SLOS stands for the initials of the physicians who discovered it, Dr. Smith, Dr. Lemley, Dr. Opitz, and S stands for syndrome. So it was found, the cracking of the mystery of SLOS was was resolved by finding is that all of these individuals had extremely low cholesterol. Some even had zero cholesterol, and this is the total cholesterol. So they had no detectable cholesterol in the blood, and some of the people who've listened to the pharmaceutical ads might think, oh, this is extremely healthy, but it was just the opposite. Those who had the extremely low amounts of cholesterol typically died shortly after birth or after a few weeks, or had really terrible infections and also malformations. And this is a typical inborn error of metabolism in which they can't work the last step in cholesterol synthesis. So there's a deficiency of the final enzyme in cholesterol synthesis due to an alteration in the DNA that codes for the particular enzyme. And because of this genetic block, this is just like what is called a log jam. So if there's a narrow place in the river and logs are floating down, they all accumulate upstream from where the log jam is. And so this is the upstream molecule called 7-dehydrocholesterol. So this is the molecule in the next to last step of cholesterol synthesis. This is the molecule that can't be converted by individuals who have the SLOS disease. And the thing that caught my attention is that 75% of the individuals with this disease were on the autistic spectrum in one study. It was found that a very high percentage, something like 98 or 99% of individuals with this have an abnormality in the toes, so that the second and third toes are joined together. And just like in autism, many of them have lack of speech, severe behavior abnormality, frequent temper tantrums, hyperactivity, violent outbursts, destruction of property, self-mutilation. The thing that is different than autism is that they have high sensitivity to ultraviolet light, and so they can't go outside very effectively. And the reason is because the high 7-dehydrocholesterol absorbs ultraviolet light, and then the person it's like a reverse sunscreen. So instead of the sunscreen blocking the sun, the 7-dehydrocholesterol concentrates and focuses sun, causing more skin damage and so forth. This is the Y-shaped toe in SLOS, and an interesting story here is my former secretary was preparing a handout of the slides, and all of a sudden I heard her screaming, and when I went to see what it was, she was yelling, "That's my toe. My toes are like that." So these Y-shaped toes are present in virtually every person with SLOS, but there are some people who have the Y-shaped toes that don't have SLOS. So virtually every person with SLOS has the Y-shaped toe, but not everybody with the Y-shaped toe has the SLOS. But if you have a child, or you know of someone who has a child, they definitely should be worked up for this cholesterol deficiency, because it's an extremely easy test to do, and you can rapidly find out if there's a problem. So in one of my seminars in Mexico, somebody jumped up and said, "That's my son's toes exactly," and he indeed had the SLOS. But it is only present in a small portion of all people with autism, even though the majority of people with SLOS have autism. The converse is not true. So cholesterol values are extremely low in SLOS, but some of them can be near the normal value. So look at the cholesterol, which is the total cholesterol in the center column. The first one, 88, but look at the second one, about cholesterol value, total cholesterol of only 8, whereas a common accepted normal used to be around 200. So the values are extremely low, but you see one of the individuals was probably had a value that was similar to a lot of people listening to this seminar tonight, 142. So there's a wide range, but all of them are on the lower side. And again, cholesterol and total cholesterol are pretty much interchangeable. So if you take those data and plot it on a graph, I'm looking at one of the common values for cholesterol, and these are in units of milligrams per deciliter. So this is a little bit complicated. If you're tuning in Europe or so forth, they use different units. I apologize, I didn't make those changes, but you can get the units that are commonly used in Europe on the Great Plains website. So after looking at hundreds of tests, hundreds of studies of cholesterol, I pretty much came to the conclusion that cholesterols below 160 are associated with virtually every undesirable disease. So I decided that that would be the value that I would choose as being low. So if you choose that as the value of low, and this is in milligrams per deciliter, 100% of the children with SLOS would be below 160. And if you use the cutoff of 100 as being extremely low, which other studies have also used as extremely low, 50% of individuals with SLOS would be extremely low. The Great Plains then looked at individuals on the autistic spectrum who didn't have SLOS, and again found a very high percentage, not as high as an SLOS, but these are individuals with just regular autistic spectrum disorder. 57.5% had low cholesterol, whereas 17.5% had extremely low cholesterol. And these values were very similar to a significant study that was done at Johns Hopkins. Johns Hopkins and a few other institutions are now involved in a double-blind, placebo-controlled study of the efficacy of using cholesterol supplements to treat autism. So this is the study done at Johns Hopkins, 100 samples, and they found 19% had extremely low cholesterol, very similar to the value of 17.5% done at Great Plains. And now a new study has been done in Turkey, found almost exactly the same percentage of children with in Turkey with autism had extremely low cholesterol also. Venezuela, a very high percentage, 2/3 of individuals with autism had low cholesterol, but interesting, in Venezuela, the percentage with extremely low cholesterol was not as high as in the United States or Turkey. What's very interesting is that the severity of the disease is inversely related to the amount of cholesterol. So as the cholesterol becomes higher, the severity of the disease is reversed. Those who had the most severe symptoms were those who had the lowest cholesterol, and of course I mentioned earlier, those with cholesterol values of 0 or 1 or 2, those individuals usually die within a few weeks of birth. So the rationale was, if cholesterol deficiency causes SLOS in some of the autistic symptoms, could it be reversed by feeding cholesterol? And so this is one of the studies that were published, and using very large amounts of cholesterol for treating SLOS. And this is a summary of the benefits seen with this in this study. So many of the children started to walk for the first time if they were crawling prior to this. Those who were older and could walk but couldn't run, many of those started to run for the first time. Their coordination improved, their motor coordination. There were some individuals who were 6 inches lower than average, and some of them went into a pronounced growth spurt just shortly after the cholesterol supplementation was started. Like some children with autism, but not all, some children with SLOS had extremely common rates of high infection. So this falls in line with the fact that cholesterol is a extremely important substance for the immune system, and I'll be showing some examples of that just a little bit later. So once cholesterol supplementation, the number of infections dropped dramatically. The ultraviolet light sensitivity decreased. They became more alert. Those who had self-injurious behavior like head banging or biting, it reduced. They had decreased tactile defensiveness, a very common symptom that's present in regular autism, increased social ability, behavior improved. There were reports of talking starting in adults who had never talked before. Those adults who were verbal said that they felt better, that they just felt more relaxed and just happier and more content. And what was very surprising is that many of the improvements happened in only a few days after supplement. And this was at a time where if you measured the cholesterol in blood, it hadn't changed. So there were some of the functions in the body that responded almost immediately to a fairly low amount of cholesterol supplementation. There was decreased irritability and muscle tone improved significantly. One of the factors I've been very interested in is why Candida causes neurologic effects in children with autism or PDD or attention deficit. And I think the reason may be is that the Candida produces a steroid called ergosterol that inhibits the same enzyme that's defective in SLOS. So in essence, if the person has a severe Candida overgrowth and there's overproduction of ergosterol, the ergosterol prevents the conversion of the 7-dehydrocholesterol to cholesterol. So the Candida, in effect, simulates the SLOS disease by causing an inhibition of the enzyme that converts the 7-dehydrocholesterol to cholesterol. So instead, if the enzyme produces a compound called brassicasterol when the Candida fungus is present. I first got very interested on a personal level when because of an incident of my stepdaughter. My stepdaughter was in a special ed school for mostly with children with autism or Down syndrome. And as you can see here, a lot of the time she was very happy, even though she is a very severely affected girl with the diagnosis of Rett syndrome. But at one time she started coming back from school with notations in her notebook, in her backpack, that said she's not doing very well, she's not participating in the class activities, and she's doing very poorly, and she seems very unhappy, and she started coming home and going to bed very early, and finally it got to the point where she would come home and get off the bus at 3 o'clock and then immediately go to bed and then sleep all night. And I kept wondering what the heck is going on. And a few days later, I went down to breakfast, and my wife was crying at the breakfast table and said, there's just something wrong with Paulina, and nobody's going to figure it out, and I think maybe she's going to die, because she just got progressively more and more lethargic and unable to do anything. And so because the good thing about working for a laboratory is, of course, we have a giant pile of lab tests. And as I went through it, I noticed that she had egg allergy. And so I asked my wife if she had, because of the egg allergy, had she reduced the eggs in the diet? And she said, oh, yes, I completely eliminated the eggs because of the egg allergy. Well, the time when Paulina began to deteriorate and become extremely lethargic and sleepy was exactly when the eggs were eliminated from her diet. So all we needed to do was put the eggs back into the diet, and she came to life again. So now she gets eggs or purified cholesterol on a regular basis. So what are some of the foods that are high in cholesterol? I mentioned the eggs, and eggs are one of the best sources. So 2 egg yolks have 500 milligrams of cholesterol. Sorry, vegetarians, but there's no cholesterol at all in plants. So no matter how many vegetables you eat, you'll never be able to raise your cholesterol. And I think that's probably one of the reasons that vegetarians, even though there may be some health benefit, are more subject to infectious disease. As a matter of fact, it's found that vegetarians are something like 3 times more likely to get tuberculosis, because cholesterol is a stimulant of the immune system. So bacon also has cholesterol. One of the best sources of cholesterol is brain, and it's because the brain makes more cholesterol than any other organ. So this is throughout the animal kingdom. Most people don't want to eat brain, and there's a lot of cultures where brain is used as a food, and it could be very useful if you have the stomach to be dealing with it. Also, liver of any source, whether it's cow or pork or chicken, also is very high in cholesterol. If you don't want to deal with these things, you don't like them, or your child doesn't like them, there is now purified cholesterol available from New Beginnings Nutritionals, and I put down the website, www.nbnus.com. This doesn't require a prescription, but it does require a physician authorization. So you just need your physician to say, I've checked out this person's cholesterol and it's low, and I want to supplement them, and then you can purchase this. If you don't have a physician who you think is amenable to this, there is a service available so that you can get a consultation with the physician. You can get the lab test, and then you can get your lab test checked, and then the physician will authorize the use of cholesterol. And this website is called GetSonicCholesterol.com. So it is Get, G-E-T, Sonic, S-O-N-I-C, cholesterol, all, of course, in one giant word, .com. The cholesterol is highly purified, and each capsule is 250 milligrams, which is equivalent to 1 egg. To give you some idea of the amounts of cholesterol that were necessary in the SLOS, some of the children had to eat 40 eggs a day, and that's 40 eggs a day, in order to bring their cholesterol up to a low normal value. So cholesterol is not something that rises usually very fast. and we have a small percentage of people, and it seems like they have a resistance to the cholesterol increasing. To give you just some ideas of some of the reactions, this is from the neurologist. The neurologist said there was a marked reduction in anxiety in a 17-year-old girl with autism. In addition, when she was 17, the girl still hadn't started her menstrual periods, and she had been given a number of hormones which failed to bring her the development of secondary sexual characteristics. But once they started giving her the cholesterol supplements, the girl had normal menstrual periods for the first time. Another case, the child was very aggressive, and after giving cholesterol supplement, he stopped headbanging and being aggressive towards others. In addition, he started to spell for the first time. She wondered maybe this was just coincidence, so she stopped giving for a week, and the child again became extremely aggressive, so she restarted, and the aggressive behavior is under control. Some of the other reports, the child had a cholesterol of only 111 prior to taking the cholesterol supplement, and he did much better. He understands and follows verbal commands. He learned to give himself a drink from the cup. He learned to climb the stairs and feed himself with a spoon. He smiles and laughs. And the mother says, at 12 months of age, my son would be best described as catatonic rather than autistic. He was extremely severe. Another one, the eye contact and social interaction was improved. And another dramatic decrease in aggression at school overnight. So this goes along with what had been seen in the SLOS studies of significant benefits. His teachers and therapists all asked what we were doing. He's allergic to eggs, but we couldn't have given him enough eggs to make a difference anyway. So the rough calculation is that you need a capsule of cholesterol for each 10 milligrams low the child is. So if the child, what I use for the normal is 160. If the child had a value of 100, then they would need probably 6 capsules a day. In reality, some individuals may need higher than that. This is a rough approximation, and there'll be a lot more research needed before we know the exact amount. In any case, individuals taking this have to have periodic cholesterol tests to make sure that the values are high enough, and also to make sure that the values don't get too high. But I will say, so far, I don't think we've come across a single case where the individual has gone too high by taking the cholesterol. So most of the time, it's the opposite problem. It takes a lot of cholesterol to bring the person's value up. Another rough diagram of why cholesterol is important, and remember that the body can make cholesterol, and also the body can get cholesterol from animal foods in the diet. So any of the foods that the body ingests can be converted to cholesterol by a very complicated biochemical pathway. The genetic defect in the SLOS disease is in the final step of cholesterol synthesis. There's a genetic block due to DNA mutations. Cholesterol is very important because it activates sonic cholesterol. It produces steroid hormones like estrogens, testosterone, cortisol, aldosterone. It produces bile salts that assist in fat digestion and also require bile salts are also required for absorption of fat-soluble vitamins. In addition, the cholesterol is needed for activating the oxytocin receptors. This is one that's missing from this slide. Oxytocin is the molecule, the social relatedness molecule that lets people bond together. It's the hormone secreted by that's secreted just after childbirth so that the mother bonds with the child. Another thing I want to talk about is that high cholesterol is very important in decreasing child mortality. These are the different average cholesterol values in different countries with the child mortality rate. So in this country that has an average cholesterol of about 125, there's a huge child mortality rate, and as the average cholesterol in the child's population increases, the child mortality rate drops. And you can see the place where where the mortality rate begins to fall off dramatically is 160, which is another reason that I've chosen 160 milligrams per deciliter, or DL, to be the important value that I believe anybody, whether adult or child, if their value is below 160, they have increased chance of dying from a wide variety of causes. And as the cholesterol value increases, what you see, the mortality continually declines with the optimum or lowest mortality rate at about 190. So I would say, based on this kind of study, that the lowest child mortality rates are in the range of 190 to 200. So I wouldn't have any problem with anybody who has cholesterol values in this range, 190 to 200. They definitely do not need some drug to make their cholesterol lower. I would say that's probably close to the optimum. And remember that the study showed that in adults, cholesterol of 260 or higher were associated with the best cognitive function. So cholesterol is very important because the cholesterol is present in the myelin, the substance that insulates the nerves in the brain cells. Half of the white matter may be composed of myelin. The brain is the most cholesterol-rich organ in the body. So cholesterol is extremely common, is extremely prevalent in the brain because it's needed. So if you call somebody a fathead, they shouldn't be offended. It is a very nice compliment, because the person with the highest amount of fat in the brain is usually the most intelligent. The cholesterol is found in the myelin. It's this covering of the axons of the nerve cells. So here's the cell body. The nerve signal is conducted down the axon, and then the signal goes to a nearby nerve, exciting it. And if this myelin sheath, which is rich in cholesterol, is damaged or is not developed because of cholesterol deficiency, the nerve impulse does not travel along the axon nearly as well. The brain cholesterol is found in the cell membrane. So this is showing the cell membranes are fatty acids, phospholipids, and the cholesterol is dissolved in there. These are a survey or a summary of the risk from low cholesterol, meaning cholesterol below 160, increased cancer, chronic fatigue, violent behavior, aggression, increased susceptibility to tuberculosis, meningococcus, increased anxiety and suicide, depression and bipolar depression. In individuals who are more than 70, those individuals who have the highest cholesterol have the lowest death rate. Individuals who have low cholesterol have doubled the death rate in individuals older than 70. There's an increased rate of stroke, cataracts in children. The children with the lowest cholesterol are much more likely to be suspended from school because of inappropriate behavior. Drug addicts are unable to kick their habit if they have low cholesterol. And you can get all the references on the Great Plains website. Now I want to turn to a molecule with the very strange name sonic hedgehog, and I'll start with showing you what a hedgehog is, this furry little mammal that has these bristles. And this particular protein was named after a video game character because a certain fruit fly had the appearance of a hedgehog, and somebody who liked video games decided, let's call it a sonic hedgehog. So this is like the Superman of the rodent world. So geneticists discovered that a mutant fruit fly had bristles that resembled the mammal called the hedgehog, and they found if there was a certain mutation, all of the development of the fly was affected. And this affects almost all creatures, from the flies up to the elephants and blue whales. So the sonic hedgehog molecule plays an important role in the nervous system, development of the nervous system, and the proliferation of stem cells. These are the cells that have the ability to alter and replace other cells in the body that have died or become inactive. So they can make the cells that make the cells of the blood, the breast, and those in the nervous system as well. Also, it stimulates the T cells that are involved in immunity in the thymus. Individuals who have mutations in this gene can have severe physical abnormalities. Sometimes mutations only cause behavioral disorders. And the extremely interesting thing about the sonic hedgehog is that the sonic hedgehog is a protein made in the cells, but the sonic hedgehog is completely inactive until it's combined with cholesterol, which is this thing that looks like chicken wire over here. So the sonic hedgehog, which is involved in the development of the brain, the nervous system, the immune system, the blood cells, is all inactive until cholesterol is attached to it. So this is a brand new function of cholesterol. It was known that cholesterol for many years was a structural molecule helping to develop the cell and the biosalts. But in this case, cholesterol is really serving as a vitamin or coenzyme. So the sonic hedgehog is why we have two eyes instead of one. So during the embryonic phase, there's only a single eye in the middle of the forehead, but the sonic hedgehog gene causes the single eye to divide and form two eyes where they are. And what's very important is that certain neurons called Purkinje neurons secrete sonic hedgehog to stimulate stem cells and brain development. And the reason I bring this up is because these neurons have been shown to be abnormal in a high percentage of individuals with autism. And now I want to go to the structure of the sonic hedgehog. So remember that to be active, it has to have the cholesterol attached, which it does here. And what it's found is that there's a certain region of the molecule called the amino acid cysteine, which is amino acid 24 of the protein. And this is the place where the sonic hedgehog enzyme activity takes place. So you can think of as a lot of the protein is just providing a structural support, whereas this particular cysteine is the active part, the part that's moving, the part of the molecule that's doing something. This is the active part of the molecule. And what's very interesting is this would be inactivated by mercury, and it's also inactivated by a common drug called acetaminophen or Tylenol. It's a metabolite of acetaminophen or Tylenol can completely inactivate this. And why I think this is very important is that although mercury is extremely toxic, this metabolite of acetaminophen is present in much higher concentration than mercury, maybe 1,000,000 times higher concentration than mercury is. And if it reacts and inactivates the sonic hedgehog protein, all of development will be altered in a negative direction. So, which brings up a couple of recent scientific papers that says, did acetaminophen provoke the autism epidemic? And their theory is that instead of the vaccines causing autism or being the major cause of autism, it is the drug given with the vaccines that cause autism. And that drug in the United States is acetaminophen. And so to look at the data, this was a Navy officer who has a child with autism who headed up the study, and they did an online survey, and what they found is that that individuals with autism who were 5 years or younger were 6 times more likely to have taken acetaminophen, and that they were more likely to have been sick following the taking the MMR vaccine. But I want you to remember that the acetaminophen, or children's Tylenol, is a common form, is being recommended by virtually every pediatrician in the United States as the what should be taken in many cases as prophylactic or preventive measure to prevent the fever when taking vaccines. So what I think is that there's a good chance that vaccines themselves may not have been nearly as toxic as the drug given to prevent fever from developing. This was a very compelling diagram showing the increase in the rate of autism, and some of you may remember that unfortunately I'm going to press escape. Yeah, so now you can see the years. So in this version, on the smaller representation, you can see that it was around 1980 that autism started increase. So that just about 30 years ago was the time when the autism epidemic first began to take off. And prior to 1980, the thing that was always used as a fever reduction product for children was aspirin. But because there was a slight association of aspirin with Reye syndrome, the recommendation was to stop using it, and so Tylenol, or acetaminophen, is now used pretty much throughout the entire United States for reducing fever. So when acetaminophen began to be used, that's when the rate of autism really started taking off. And autism went very high up until the time there was a terrorist event in which a deranged individual loaded Tylenol capsules, that's the brand name of acetaminophen, loaded the Tylenol capsules with cyanide. And I think maybe several people, like 7 people died because the cyanide was placed in the acetaminophen capsules. But as far as the autism rate, it began to plateau because for a long period of time, people didn't take it. They just wanted to be absolutely sure that all that poisoned acetaminophen was gone. And as a beneficial side effect, the rate of autism plateaued for a period of time until people began to forget this thing and go back to using acetaminophen. And then, of course, when they did, the rate of autism shot up again. And then there was a second acetaminophen or Tylenol scare. And again, people stopped using it. And again, the rate of autism fell off. And again, people, after a period of time, they forgot about it and started using it. And the rate of autism continued to climb. So I think that this is one of the best theories that I've heard, and definitely the acetaminophen is toxic. There's only a small difference between a therapeutic dose and a toxic dose. It's extremely commonly given, and yet there is about 500 people who die of acetaminophen poisoning every year. The fact that an additional fact that makes me think that plays a major role in the autism epidemic is that in Germany, acetaminophen is not a favored drug and ibuprofen is used. Germany only has about 1/5 the rate of autism as the United States because acetaminophen is used very little, and when it is used, it's used at lower doses. Another factor that influences cholesterol are the proteins that transport cholesterol, called lipoproteins. And there are several different types. Lipoprotein has lipid or fat, and also protein, a large molecule of amino acids. And they have different names, which would begin with capital letters A, B, C, E, and then little a. All of these are different proteins that transport cholesterol. A study was done on autism out at the Mind Institute, and they looked at these proteins that transport cholesterol, and what they found is that the lower the amount of these proteins that transport cholesterol, the more severe the autism. So values in children with autism were significantly lower than normal individuals, and this was a study in which they looked at something like 6,000 different proteins in the blood of these people. So of these huge numbers of protein, the alteration in the proteins that transport cholesterol was the most common abnormality. Now the discussion of what is called good and bad. So these are conventional. I'm not endorsing these. I'm just telling you what the common names are. So HDL cholesterol is called high-density lipoprotein cholesterol, or good cholesterol, and LDL is called low-density lipoprotein, or bad cholesterol. But these names are gross oversimplifications, and in many cases, bad cholesterol is really good for you, and cholesterol itself may be very good for you. So the so-called bad cholesterol is needed to transport cholesterol into the brain, which is very important when it's deficient. It was also found that individuals who had low amounts of bad cholesterol had higher rates of heart failure. So again, having high amounts of bad cholesterol was good. So these terms are just arbitrary and really not to be trusted at all. Again, another study showed that so-called bad cholesterol protects humans against infections, that staph bacteria produce endotoxins that have the ability to kill human cells, but the bad cholesterol protects the body from these pathogens, which can be fatal. And here on the left, we have an actual sheep that has a cyclops eye. We have the depiction of the cyclops from Greek mythology, and we have in the middle a Photoshop picture of the person, a fake picture with a giant eye. But the one on the left is true. There are sheep on a certain islands in the Aegean Sea that have these cyclops eye. And what it was found that on these islands there were certain plants that grow that produce a compound that is very similar to cholesterol. It's called cyclopamine, and the reason why it's called cyclopamine because if you eat enough of this, it causes a cyclops eye. But you can see the structure is extremely similar to cholesterol, and because of the similarity, this cyclopamine, which is in the herb veratrum, if the sheep eat this, they get the cyclopamine, and the baby sheep that develop from the mother eating this plant develop the cyclops eye. So this may be how the Greek mythology came up with the idea of the cyclops, because of high incidence of sheep having this abnormal eye. This compound was also used as an experimental cancer drug, and the mother was treated with the drug, and unfortunately the baby had the same abnormality as the sheep. The low cholesterol is associated with suicide and suicidal thinking in children hospitalized for psychiatric disease. It was found that children who were having adjustment disorders with depression had much lower values of total cholesterol than normal children. And it was found those who had the lowest values were those who had suicidal tendencies or who had attempted suicide. Also that individuals with low cholesterol were much more likely to be involved with substance abuse. Cholesterol deficiency is extremely common in chronic fatigue syndrome. This was studying 4,000 patients, and it found that 2/3 of patients with chronic fatigue syndrome had extremely low cholesterol values. It was also found that in individuals with tuberculosis that a high cholesterol diet could help the person recover from tuberculosis. And I'm going to go a little bit fast because we're getting low on time. But in any case, studies have shown that cholesterol is necessary for the functioning of the white blood cells, certain ones called the macrophages and lymphocytes, and that the study shows that when individuals were put on a high cholesterol diet containing a lot of eggs, those who were on the high cholesterol diet recovered from the tuberculosis much faster, so that their lungs were free of the TB germs. It was also found that that individuals with low cholesterol had a much higher incidence of cancer, and this was true of all types of cholesterol, the total cholesterol, the HDL cholesterol, and LDL cholesterol. If they had low values, they were much more likely to have leukemia and Hodgkin's disease. It was the same kind of relationship was found in endometrial cancer, that there was a 3 to 4-fold increase in risk of cancer in individuals who had the lowest cholesterol values. In adults who have suicidal tendencies, it was found that there is individuals with low cholesterol were much more likely to have suicidal tendencies or to attempt suicide, and the findings imply an association between low cholesterol, suicide, and depression. The same thing for Parkinson's disease. Those who have low values of so-called bad cholesterol were 3 times more likely to have Parkinson's disease. So the kids have committed some infraction. They're on the long walk to the principal's office, and one asked the other, can she really have him throw us into a dank, dark dungeon where we won't see the light of day until we're old and gray? And what it's found is this walk to the principal's office is associated with low cholesterol. Those individuals with the lowest cholesterol were much more likely to have problems. So it was found that non-African American children with cholesterol below 145 were almost 3 times more likely to have been suspended or expelled from school. So drug abuse is also associated with cholesterol. Not only is low cholesterol a risk factor for developing drug abuse, but for those who have low cholesterol, it's much harder to rehab successfully, which may be the reason that all these models we see in the press are always going in and out of rehab because they're are so skinny that their cholesterol values are so low that the low cholesterol produces a type of mindset or mind functioning so that they have greater difficulty in getting out of rehab. So those individuals with low cholesterol were much more likely to be unable to kick the habit, and it was found that those individuals with the highest cholesterol were much more successful in kicking the habit. So a very nice graph. Individuals with high cholesterol, about 90% of them were still free of cocaine after a year. Those who had cholesterol less than 160, only 50% of those individuals underwent successful rehabilitation. The same thing with heroin. Individuals with the heroin addicts also have significantly lower values of cholesterol and HDL cholesterol. Violence and anger also have a pronounced association with low cholesterol. So it was found that monkeys that consumed a low cholesterol diet were more aggressive, less affiliative, and had lower values of the serotonin metabolite in the cerebrospinal fluid than their high cholesterol counterparts. So a direct association between serotonin, the feel-good molecule, and cholesterol. The lower the amount of cholesterol, the less serotonin activity was present. It was found that in mothers who had low cholesterol were much more likely to have a baby with problems, either a small head or a baby who was smaller than usual, much more likely to have a preterm baby. So getting toward a summary here, cholesterol has very important activities. Cholesterol is needed to activate sonic hedgehog. Cholesterol is needed to activate a G protein that makes the serotonin receptor work. Cholesterol activates oxytocin receptors that enhance social interactions. It produces all the steroids that are necessary for sexual development, cortisol in dealing with stress, aldosterone dealing with mineral balance. It also produces the bile salts that are involved in fat digestion and absorption. In addition, it is a structural component of myelin, which is needed for nerve functioning. So cholesterol has an extremely important function, and we could also add here, cholesterol is important in cell division. It helps to make sure that when cells divide, that each cell gets an equal number of chromosomes. So what you want is each cell to end up with 46, not one cell to have 47 and the other 45. So cholesterol is also involved in making sure that cell division happens such that there is a normal distribution of chromosomes to the daughter cells. So the summary, cholesterol is an essential nutrient, although humans can make some in their own body. Cholesterol deficiency is associated with preterm delivery, abnormally small head. It leads to increased infections and higher incidence of almost every psychiatric disease and social ill. The optimum cholesterol appears to be between 160 to 200, although some of the studies when an adult show that cognitive function was even higher with the higher amounts of blood cholesterol, up to 260. The thing is, above 200, there is a somewhat of an increase in death due to heart disease. So some people, when you get above 200, may have to decide, do they want to die with their brain intact, or would they rather have a lower cholesterol that lets them live longer, but with a brain that's defective? So that seems to be the choice. But so the optimum really is not exactly known, but I would say a value between 160 to 200 would be fairly safe. Cholesterol less than 160 is associated with increased mortality from infectious disease, increased risk of psychiatric disorders, neurologic disorders like Parkinson's, infectious diseases, and cancer. In 2 studies of autism, more than 50% of individuals with autism were deficient. The transport of cholesterol is defective in autism. Autism symptoms have been reversed in the genetic disease by using high doses of cholesterol. Statin drugs reduce substances such as coenzyme Q, heme needed in the mitochondria, specialized transfer RNA, can cause the breakdown of muscle, rhabdomyolysis, renal disease, and memory loss, as well as chronic fatigue. Individuals taking statin drugs should definitely be taking coenzyme Q10 because the statin drug prevents its adequate synthesis. Candida effects in autism and other disorders may be mediated by ergosterol, an inhibitor of cholesterol synthesis, which simulates the biochemical abnormality of SLOS. The sonic hedgehog, which is activated by cholesterol, is one of the most important proteins in human development and brain function, and it requires cholesterol and a fatty acid palmitate to function. And as far as the relevance to autism is that the active site of the sonic hedgehog is likely inhibited by an acetaminophen metabolite, a common drug used for both babies and children. And I think that this is a very compelling hypothesis and perhaps the correct thing. And if this is true, it should be easy to reduce autism back to its pre-1980 pre-1980 incidence simply by stopping the use of acetaminophen completely in children. It wasn't used hardly at all prior to 1980, and there are a lot of different substitutes that can be used. So it seems like a very valid answer to me. So thank you very much, and I'll see what I'll answer some questions now. Okay. Yeah, I hope this worked because show question. Okay. Okay, now I found the right button. Okay, so there's a lot of questions. I think if this recording worked well, we may put this on our website. I'll just have to see. I got one message that said there was a problem, so we'll have to see if that's the case or not. GPM progress is fine to know. Cholesterols are low. You just have to do a lab test. There's a question about cholesterol values, and so you have to just do a lab. I mean, it's available all throughout the world. Great Plains also does it. If you want to send your test to Great Plains, the value is, we know what the appropriate values. Most of the labs in the world would say if the value is below 200, that it's okay, but that's not true. And so so it's very important that you get a test and that the value be greater than 160. If the value is less than 160, and that's the total cholesterol, your child is deficient. My son thinks that it might be the son. So if the person is saying that the cholesterol is only 112, then he's still not doing too well. Well, the thing is that you have to get the value up to 160. So I don't know what the situation is. I mean, anybody is welcome to contact me or my nutritional consultant, Pam Guilford, to get additional feedback. But the cholesterol value has to get up to at least 160 to reverse anything. The person also is indicating that their child has Tourette's-like symptoms. Tourette's symptoms are commonly associated with streptococcus antibodies, so that's the appropriate test for this. Remember, I'm not advocating this supplement as this is to replace cholesterol in those who are deficient. There are many factors associated with autism, and they all need to be addressed. There's not just a single factor. My last cholesterol was 131. So the value is still too low. Yep. So the value has to be 160, and the way to increase it is by either giving supplementation or giving foods that increase cholesterol. So any of the foods I mentioned, liver, brain, eggs, they all are very high in cholesterol and can increase cholesterol. I'm sorry about the low volume. I should, I guess, that maybe there was some problem, but I didn't have any feedback. I had someone who was listening to this, who was checking on this, but so I don't know if this was just for a particular computer or whether there was a problem with a lot of people. If there was, I'm sorry. I apologize. I'll ask for feedback earlier. Yeah, so for individuals who have low cholesterol, this is from a psychiatrist who had a number of children in the school. Giving eggs is a very good alternative. The only problem with this are eggs are also one of the most allergic foods. So you want to make sure that the child does not have egg allergy. So if the child has egg allergy or doesn't like to eat eggs, then the supplement of cholesterol can be used. So another question about what can be done for the individual who has is way underweight and things like that. So the low cholesterol could indeed be a big factor, as you saw in the SLOS, that some of the children had a growth spurt of up to 6 inches after being supplemented with the cholesterol. So if the child is extremely behind in height or weight, the cholesterol supplement can be very useful. And the question: any association between low cholesterol, between MS and ALS? I think I have seen some articles on those as well, but I'm not positive. I would think it's very likely, since I've seen this associated with most neurologic disease, that the cholesterol is definitely something that you should be looking at if you have either ALS or MS. I would definitely be getting a total cholesterol, and again, if the value is less than 160, consider dietary intervention to increase that. I want to emphasize the value of 160. You can use that value throughout the ages. So you can look at that as a value in children as well as in adults. If you remember the graph on child mortality, the child mortality didn't get to a decent level until the average population of children reached a value of 160. So 160, I feel very confident that that can be used as a decision value in both children and adults on the decision to increase the child's cholesterol either by dietary supplementation or taking nutritional supplements. What I recommendation is, if you taking the cholesterol supplements, you would use 1 capsule for each 10 milligrams of cholesterol that is low. So if your cholesterol was 150, as I mentioned, the lower limit of normal is 160, so that would be 10 points low. So you need 1 capsule for every 10 points low. If your child or yourself were 60 points low, then you would need 6 capsules. If you or your child's cholesterol value were 100 points low, you would need 10 capsules. So you take your child's value in milligrams, subtract it from 160, and then drop a 0 or divide by 10, and that's the one. So for every 10 milligrams low, you need 1 capsule or 1 egg or some other product that's high in cholesterol, like liver or um, or other substance. And for those who have for those who want to do this, the best thing, of course, is you can get in contact with New Beginnings. If you have a physician, once your physician has approved it, the New Beginnings can give you the additional counseling, and also if you don't have a physician familiar with this, you can go to the GetSonicCholesterol.com, where a physician can arrange for you to get cholesterol testing, review it, and then make recommendations for it. So you need a physician's assistance if you're in the United States. And for those who have other questions, of course, you're free to contact the laboratory by either email or by telephoning and contacting us. You can contact New Beginnings, or you can contact Great Plains. Great Plains website is gplforyou.com. New Beginnings Nutritionals is ndnus.com. And I'll repeat these a couple of times. So just remember, just to repeat one more time, for every 10 milligrams below 160, 1 capsule of purified cholesterol or 1 egg extra per day would be required. If person's cholesterol is in the 400s, that's a different story. So people who have very high cholesterol, they do not want to take this, and they may in fact be in the groups that want to lower their cholesterol, and statins may be effective in people who have extremely high cholesterol values. I think after seeing all this data, I think if this were me myself, I don't think I would be taking cholesterol lowering drugs unless my cholesterol was above 260 or so. If it was above 260, I think I might consider the cholesterol lowering drugs, but I'd be very careful to make sure that my cholesterol didn't get too low, and I would also make sure I would be taking coenzyme Q10 on a daily basis, because that coenzyme is knocked out when you're taking the statin drugs. There's a very, it is low cholesterol. So a question again about MS, and what I strongly suspect is that the low cholesterol indeed is associated with the myelination problem. A number of studies have shown defective myelin synthesis in MS, and even though I can't quote an exact study, I'm almost positive I came across some, and so I would think it's very likely that low cholesterol could be a major factor in MS. And for any of the people out there who have MS or have a relative with it, I would strongly suggest that you get cholesterol testing, and you could contact the GetSonicCholesterol.com and ask for recommendations. To reduce fever, so one of the first things is fever is a benefit. So the question is, what do you do to reduce the fever? Well, the first thing is don't do anything to reduce the fever unless the fever is excessive. And there are a lot of physicians out there who say don't take fever-reducing agents if the fever is below 103. That is a healthy fever response. Fever stimulates the immune system to work better and to kill disease. A number of studies have shown when you reduce fever that the illness lasts longer and that the immune system doesn't work as effectively. And so I think a lot of people have overreacted, thinking that the slightest amount of fever is like a deadly thing or something like that. Mild fever is a completely healthy response to illness, and I think it is a big mistake to give prophylactic treatment for fever that hasn't even happened. And especially now, since the survey that shows that the use of acetaminophen greatly increased the risk of autism. Those individuals who had taken acetaminophen were much more likely to develop that. What's also interesting is that the same study showed for those children who took ibuprofen, there was no increase in autism. So it's very interesting to me, because in Germany, ibuprofen is the drug of choice given to children, and Germany only has about 1/5 the incidence of autism as the United States. So I strongly suspect that the reason is that acetaminophen is used much less frequently in Germany, and this would be a nice follow-up study to look at autism incidence and the use of analgesics. And I think what I'd like to do at some point is to do a study in which individuals would voluntarily agree not to use acetaminophen in themselves or their children, and see if autism disappears. I think this is a really interesting and potentially valuable set of studies. Do egg replacements contain a cholesterol? No, so they wouldn't be. It is the yolk of the egg that contains cholesterol, so the egg replacements that don't have the yolk, that are made just from the white, would be completely useless as far as cholesterol replacement. So a person indicates that their child who has a genetic disorder called mucopolysaccharidosis 3 has the abnormal toes, and so I think it would be in this case very worthwhile to see if the child has low cholesterol and to consider supplementation if the values are low. Okay. In individuals who can't take capsules, it's very easy to pull the capsules apart. The cholesterol really is very bland. It's almost tasteless, and so you can mix it in with virtually anything or put it in applesauce. So it's not a problem at all. Unlike B vitamins, which are very bitter, the cholesterol is virtually tasteless, so it's not a problem at all. Yeah, and then a person asked again, just a confirmation, that 160 to 200 are acceptable numbers, although the adult studies also indicate that higher numbers are associated with better memory and cognitive function. And actually, a study found that in individuals over 85, those individuals who had the highest cholesterol had the highest longevity. So the whole war on cholesterol is somewhat directed by the financial incentive. The patient has a poor high cholesterol diet but still low cholesterol. What would you do? Now, okay, they're saying their child has a value less than 100, even with giving a low cholesterol diet. I just want to remind you that in the SLOS study, they had to give some children 40 egg yolks a day, in order to bring the cholesterol up to 100. So in some individuals, they will just have to be more aggressive in giving the amount of cholesterol in order to bring it up. So you're talking about perhaps using both eggs and liver, and maybe even considering brain supplement plus additional cholesterol supplement to bring the cholesterol values up. Why doesn't okay, very good question. Why doesn't acetaminophen affect all children? Okay, and this, if you remember, there was a study done by Rosemary Waring that showed that children who have autism have a defect in a process called sulfation. So sulfation is the main way acetaminophen is detoxified. But if the individual has this inability or lack of ability or somewhat disability in sulfation, they won't be able to detoxify acetaminophen, and so they would be much more susceptible. And then in relating it to autism is the other factor is that cholesterol is needed to activate the sonic hedgehog. So if the individual has low cholesterol, there's only a small portion of their sonic hedgehog that's active if they have low cholesterol. So a baby or child who has low cholesterol and also has this inability to sulfate, which a lot of kids with autism don't have, those individuals would be much more susceptible to having a bad reaction when acetaminophen is given. And then another factor, which is even more disturbing, is the fact that a number of the drug companies have had their plants shut down because the amount of acetaminophen in the product was much greater than what they said. So some individuals may have gotten poorly manufactured acetaminophen in which the amount of acetaminophen was much higher than was actually than it was supposed to be, and so they could have gotten bad acetaminophen. So all of these factors could play a role in why certain individuals had that. And then there's also the factor that the parents may, since the acetaminophen is an over-the-counter product, that the parent loses track of exactly how much they've given to the child, and so that they give too much because, you know, they're getting up in the middle of the night, the kid is screaming, and so they reach it and they can't remember how much they did, but they know he's still screaming, so they give more. The acetaminophen would have an especially bad effect on those individuals who had low cholesterol, because the cholesterol is needed to make the sonic hedgehog protein work, which is needed for development, especially in the brain and so forth. So, so either factor, having low cholesterol or having the low ability to detoxify acetaminophen, because acetaminophen is detoxified by the sulfation pathway, which is deficient in autism. The easiest way to compensate for low cholesterol is to increase the amount of cholesterol in the diet by the foods I've mentioned, and or by using the supplements. Here's a case where, okay, my child is 161. What should I do? Well, that's pretty much, I'm at the exact place, and I would like to give our daughter a much higher dose and get her, okay, what would happen if she were, if her value were 200 or 210 or 220? Would she get even better? And I think it's possible, but I'm reluctant to make that recommendation because of the politics. I don't want the politics of the therapy to get out of hand or to be criticized. But since adults with much higher cholesterol values have had even better cognitive ability, I suspect that individuals will, with higher amounts of cholesterol, might even do even better. Individuals with values greater than 200. But I think in order to do that, it would probably justify, you would probably need a clinical trial, which is done under medical supervision and so forth. Just remember that the supplements are just the pure cholesterol available. It's called Sonic Cholesterol, and it's available from New Beginnings, nbnus.com. You can get the phone number. You won't be able to see it on the website, though. You have to call or email the company, and you have to ask your physician to authorize it for you, or go to the getsonicholesterol.com. All as one long word, getsonicholesterol.com. You can get the medical review, the testing, and then the recommendation. The same thing with ADD. Now, I want to emphasize is that what I suspect is that all of these individuals with all of in which the individual is low in cholesterol will all benefit, whether it's depression, bipolar, anorexia nervosa, psychosis. All of these individuals, if they have low cholesterol, will probably benefit by cholesterol supplementation. And there are a number of psychiatrists who use our services who indeed are using such supplementation for a wide range of people who are low in cholesterol. But definitely the same thing true of individuals with ADD or ADHD. Yes, the question again about the 160, my feeling is that the number of studies is so large in both adults and children, and in both groups, values below 160 are associated with increased illness. And then I have some other comments about the sound. Some individuals had to turn sound down. So unfortunately, I guess this is just the sound thing just had to do with the individual system or volume control. One individual saying he picked it up fine in Pakistan. Now remember a question about specific food to raise cholesterol. The three foods, liver, that's of any source, cow, pork, chicken, all those livers will very good source of cholesterol. The brain is very good source of cholesterol, and you might have, maybe you can get the butcher to put it into slices so you don't have to work with it too much, or eggs. All are very good sources of cholesterol. The problem is, in many cases, getting your picky child to eat it. And let's see, and now a question again about getting the copy. The intention is to make these available on the website, the entire conference, if it's been successfully recorded. And okay. Okay, I think maybe I think I've covered everything. So thank you all for coming. I think I appreciate all your questions. They were very good. And if you have additional questions, you can contact me at William SHA@AOL.com. That's William SHA@AOL.com. And again, remember the different websites where you can make inquiries. The New Beginnings has the cholesterol, nbnus.com. Great Plains offers the complete cholesterol testing, including the testing for the cholesterol transport proteins, and that is gplforyou.com. The letter G, the letter P, the letter L, the number 4, and the letter U.com. GPL, the number 4, U.com. So thank you all, and good night.